Good morning, and thank you so much for having us. I'm going to speak during the first part of this session, and then Ms. Makare will speak afterwards about her personal journey. So you can go ahead and advance the slides, Kristen. So I'll talk about mental health challenges in sickle cell disease and kind of the areas where people with chronic health conditions get stuck. And then I'm going to talk about this model that we use at the National Cancer Institute and with NHLBI at the NIH, which is acceptance and commitment therapy. And then we'll hear from Ms. Bakare. Next slide. So depression is really fairly common in people with sickle cell. The rates vary depending on what research study you look at, but the average is about 35 to 36%. Whereas in children with sickle cell, you see depression in about 4 to 46%. As Dr. Devon and Darbury both mentioned, there's such a relationship between depression and physical well-being and other aspects of mental health and quality of life. All of these things are connected. We also know that when someone with sickle cell goes into the hospital, such as for a pain crisis, if they have depression, that puts them at risk for staying at the hospital longer. And we also know from research that how people respond to pain impacts how severe their depression is. Next slide. About a third to a half of people with sickle cell report anxiety. It's related to fatigue and depression in sickle cell. And there was one study that found that people with sickle cell who were prescribed higher doses of morphine had lower quality of life and higher anxiety compared to those with lower doses. Now, that doesn't mean that the morphine caused the higher anxiety, but in general, it's associated with more of the worst quality of life and higher anxiety. Next slide. And in our culture, there is this sense that if we have pain or sadness or anxiety, it's bad. We have to get rid of it, right? If you go into the self-help section of any bookstore, these are the kinds of titles you're going to see. Get rid of depression, help your child become happy and worry-free. And this model that we use for mental health says that this might be part of the problem, having this expectation that these things are inherently bad and abnormal. So I'm going to talk about a different approach. Next slide. And there are two areas that where we see people with medical conditions get stuck, and that leads to mental health difficulties. The first is inflexibility. The second is avoidance, and I'll talk about each of those. So next slide. What I mean by inflexibility is holding on to thoughts really tightly. So when you have a thought, you take it as absolutely true and you don't look beyond that to see if there are other possibilities. So sometimes people with sickle cell might think, okay, when my pain gets to a 6 or a 7 out of 10, I have to take a pain pill. And sometimes that may be the best response, but sometimes it may not. Right? Or I have to find a new medication or see a new doctor that's going to help me. Or even just on a daily basis, I have to go to work today or I have to stay home today. And where there's no room for any flexibility in that, that's when it becomes problematic. And being inflexible in terms of, being open to new approaches and ideas. And then having this sense that you know what you can and can't do. And sometimes I see people with sickle cell and other health conditions, if I suggest something, they say, oh, I know that's not going to work. But that means they're not being open to the possibility that it might. And that's associated with more difficulties down the road. And then avoidance. This really nice quote here, avoidance is the best short-term strategy to escape conflict and the best long-term strategy to ensure suffering. But what we see in people with chronic health conditions is that they tend to avoid things like their usual activities. They avoid relationships and connecting with people that they care about or meeting new people. They avoid opportunities that they would otherwise jump on, and they avoid things that they are normally really interested in or things that they really care about. So what do these things have in common? Well, both inflexibility and avoidance are attempts to control our thoughts and feelings, right? If I avoid this, then I won't feel anxious or I won't have pain, right? But doing all of this avoidance and being so rigid consumes a lot of our time and a lot of our energy. And that's time and energy that we could be using to pursue what we most care about in our lives. So another way of looking at this is psychological flexibility. And that's defined as our ability to adapt to life stressors, both external stressors, like what happens in your workday, for example, and internal stressors like pain. Now, being psychologically flexible is more strongly associated with a decrease in pain-related disability than pain itself, right? Pain, how frequently you experience pain and how severe your pain is. So ACT, acceptance and commitment therapy, is a model of psychological flexibility. So again, this is the approach that my clinical team of psychologists at the NIH uses when we work with medical patients. And it's pronounced ACT as a word rather than ACT. And there's a lot of research support showing that it helps people with all kinds of things like depression, anxiety, pain, and trauma, and others. So a few components of ACT, one of them is mindfulness, which is being in the present moment without judgment, right? So much of our time we spend in the past rehashing things that happened yesterday or a year ago or 10 years ago, right? Or in the future, thinking about, oh no, what's going to happen tomorrow? What's my pain going to be like tomorrow? Am I going to be anxious when I have to do this or that? So it really is focusing in on the current, on our present moment, right? What's happening in the here and now. Next. A couple different ways that we practice mindfulness are things like mindful breathing, mindful movement. And all of these things are things that you can look up on the internet, and you will find a lot of information on mindful breathing, just learning to breathe while focusing on the breath and nothing else. Mindful movement, so things like taking a walk mindfully or doing something like yoga or Tai Chi. And then other mindful activities, just going through your daily routine, listening to music mindfully, being really in the present moment and focusing on it, eating mindfully, playing music or whatever hobbies or things that we enjoy, doing it fully connected in the moment. And of course, I think our cell phones are the things that pull us out of being mindful the most. So I wanted to just raise that as a comment there. Next. But why? Why should we be mindful? So when we are not being mindful, we're kind of going through life on autopilot. We're not really focusing on the moment. And that means that we make choices based on just habit or an impulse rather than what's important to us, right? So I'm not going to go to my friend's birthday dinner tonight because I might get anxious or I might start having pain. Or, well, I have this exam tomorrow or a big presentation at work, but I'm in pain, so I've got to take my pain pill. And that might interfere with you being able to really be present in those activities. We know that mindfulness helps with things like depression and pain coping and probably anxiety. There's a little bit less research in that area. And it's also really helpful to learn to practice mindfulness when things aren't too bad, right? It's really hard to learn a new skill when you're stressed out. So when you take some time when you're not really stressed out and practice mindfulness, you can kind of build up that mindfulness muscle. It's a skill that we have to practice. Next. The second component of ACT I'm going to talk briefly about is acceptance. A lot of people, when they hear acceptance, they think, oh, that means giving up or just being resigned to your fate. And that's actually not what we mean at all. Next. What we mean is, and you can cycle through here, thank you. This great illustration here, you can't get rid of your fears, but you can learn to live with them. You can have tea with your fears and anxiety. You can change your relationship with them, right? Or change your relationship with your pain or your sickle cell. And it can be really hard. And that's one of the things that we work on a lot with the people that we see. And acceptance is, importantly, being willing to experience the pain, the mental or physical pain, if it means it's moving you closer to something you care about. So being willing to study while you have some pain, or go to that birthday dinner, even though you might get anxious, being willing to experience those difficult thoughts and feelings in the service of something you care about. Next. And then values is a really important piece of this model, because people with mental health conditions can lose sight of their values. They're so focused on controlling their pain and avoiding anything that might cause pain or anxiety or sadness that their world kind of shrinks. And all of these really important things out here, they lose sight of because they're only focusing on trying to control their thoughts and feelings and physical sensations. Whereas research suggests that when we engage in values-based actions, doing things that connects us with what we care about, that can actually help decrease depression and a lot of other problems. Next. So what do we do when we identify our values? Well, we come up with goals that relates to those values. So maybe the goals can be around taking medication, nutrition, exercise, spending time with people that we care about. Next. And you can go ahead, there you go. And so we work with people to really plan those things out. Let's just not say that spending time with loved ones is important to you. Let's plan out, when are you going to connect with someone you care about this week? Where will you do it? For how long will you do it? Let's make a commitment that that's something that you want to do. And then notice how you feel, not just in the moment when you're doing it, but also when it's done. Do you feel like, wow, okay, that was really good for me. I really was able to connect with someone that I care about, or something that I care about. Next. And I want to wind down by mentioning some resources that I encourage you to look into. These are some books that I find really helpful. They're written in a very clear way that you can kind of really hopefully relate to. But they're all about different aspects of this ACT model and or mindfulness. And the Full Catastrophe Living book is actually talks a lot about using mindfulness for pain. A couple of good ACT websites. And then I recommend these apps as well to people, ACT Coach and Insight Timer. Those can be really useful. And if this is, something that you're interested in, or you think you might want to hear more about, I really encourage you to go and look through these resources and see if it's something that might be helpful for you.